We were off to such a good start last week, and we scratched the surface of different aspects of psychosocial sexual behavior, especially some of the sexual practices that cultures condone, even when they are unhelpful for the people of the culture, and they end up creating residual mental health problems like anxiety. We are just about to find out what kind of relationship anxiety has with sexual issues. Is it a one-way relationship? Is it bi-directional? Stick with us and find out. So yes, back to our question about confidentiality and secrecy. I think that with certain cultures, and this is my thinking, so I'm happy to discuss it with you. Are we able to differentiate the two?
I think it's a really interesting question because I haven't thought about it so much in a cultural context, but now you've made me think about it as such. What I would say is I always guarantee my clients confidentiality, but I start with every new client, before I even ask them to tell me what's the problem, I always think they need to be informed. So I always start with saying what confidentiality means, and I'll make notes, but I lock that away and I'll be able to read it. But I say, however, if I'm concerned that you're going to harm yourself or harm somebody else, then I would need to act on that. But of course I will discuss it with you first. So that means they know what confidentiality means. You can tell me anything you want, but if you're going to hurt somebody else, you're going to hurt yourself, of course I'm not going to sit there and so that's confidentiality, absolutely. And luckily there's not been too many times, probably because I do make it clear from the very beginning, but if I had to breach confidentiality in terms of to stop harm from happening, then I would, and that's my responsibility as a professional. And sometimes there's a big worry about that because it might ruin the therapeutic relationship, or harm. It's got protection of people's well-being has got to come first, but that very rarely happens, I'm very pleased to report. And so that's on an individual basis. As a professional, I think what we should all be doing, and most people are taught to do that. And interestingly, I could say so much, I'm trying not to say too much. Interestingly, I think it's also really important that we think about secrecy and what's helpful and isn't helpful. For example, a very quick example, years ago, because I worked at the trauma clinic, whatever was going on in the world, we'd have asylum seekers come to you. Exactly. And I worked with a number of women who in the Bosnian War, who had been had post-traumatic stress disorder because they'd been raped by the soldiers. And in their country, now normally as part of PTSD, the treatment, we help people to process the traumatic memories because they're stuck with awful traumatic memories, update them with the reality now, and then we help them afterwards to reclaim their lives. So, for example, the London bombings, I help people to be able to go back on the tube and the buses where these terrible atrocities are happening. It's quite a relief for people to realise, my God, people are still sitting on the tube and it's boring and nobody's talking like they do in England. It's not, all falling apart in this terrible, dangerous place. So, with reclaiming their lives in terms of rape, sometimes we might help them be able to go to the area or somewhere that scares her now with no longer being scared. And so I remember with one client, and she described her husband as really, really loving and all of this, and she'd been having problems with sex because of the terrible rape she'd gone through, and he never knew about it. And I remember, this is years ago, and I was less experienced than I am now, but I knew about confidentiality. And normally, if it was felt appropriate for the partner to know, then we would help the client to tell the partner. And this woman was so adamant that there's no way he could know. And to know. I was helping to alleviate a sense of shame, but he sounded so lovely that I felt it would be helpful for him to know. And I remember when I spoke to my supervisor, who had no knowledge of the culture she lived in, and she was saying to me, no, she's avoiding, you should make her tell her husband. And thank goodness I didn't, because this woman had been so open with me and she described him as so lovely. But then I actually got her to give me accounts of how some of the husbands had responded when they had found out about it. It had been terrible. And this woman, the status of her would have been really denigrated, and so often husbands leave their wives, and even the families can leave them because it's brought as being a shame to the community, even though these women were raped involuntarily by soldiers. And having that information really helped me to realise her secrecy was
Yes.
for a valid reason for her.
Yes.
And not from a culture. I
Yes.
couldn't possibly understand how they were going to respond.
Absolutely.
That makes sense. And I've always kept that in mind.
Yes.
And when I asked about these husbands, and they had seen nice and caring husbands, but the norm in that culture was we cannot have women like this because they represent something too awful for us to tolerate.
Yes.
Yeah?
Yeah.
And on a wider cultural level, just recently, in fact, yesterday on the news in the UK, there has been recent developments whereby in certain parts of UK there have been I think Pakistani groups of men, basically paedophiles, who've been grooming these young white girls. And when this first came out, I can't remember, years ago, since I've been here, the police didn't act on it because they were very scared of being accused of racist, because the police in the UK are often racist, particularly towards black guys, and they've been deemed to be institutionally racist by a police report. So they're always scared to go down on a group of non-white people, if you like. And this caused, and this meant that they didn't really act on it or take it forwards for years, despite a number of women, social workers, seeing these young girls, saying there's something wrong here, and reporting it to the police. And so a number of girls were innocently raped and, repeatedly gang raped by these paedophiles, basically. And then there was a massive case, I think it was in Rotherham, and then one of the findings was they kept the secrecy because they thought it was a cultural thing.
Right.
As if any culture should allow adult men to be raping anybody, and young girls, and they showed how they grew them, etc. And it was really good learning because it was really important to see how you can't let culture indicate how you should respond. Absolutely. You need to respond appropriately. And these women were doing well in terms of brain confidentiality, but the police weren't acting on it, and they were keeping secrecy for their own reasons, really, rather than protecting the children. And I think they might have even construed it in the wrong way because of culture. It's a cultural thing. A bit like what used to happen in the UK, and now there are laws against it, when, for example, young girls being taken away to a different country for genital mutilation, or being forced to marry as a young child, being taken away, lied to and said you're going, forced marriage, being told that you're going on holiday and all these things. They're actually illegal now. But these are things that it's taken a lot of campaigning, because before people thought, exactly, well, it's a cultural thing, we shouldn't get involved. A bit like how domestic violence used to be years ago. So the impact of culture on secrecy and confidentiality is really, really important. And it can be such a big deal where it can, save lives if people act appropriately.
That's brilliant. Thank you for sharing those experiences too. It makes it very clear. Now, we've mentioned this already. We spoke about anxiety and the relationship between sexual problems and anxiety. Just to clarify, I'm just wondering what the relationship is. So does anxiety give rise to sexual problems, or is it the other way around? Just briefly.
It's a very good question. What I tend to see most is that's a good question. I'm going to talk about men and women, okay? Just because they've had different presentations. Actually, it's possibly not true, but what I will say is that many people that I see have a pre-existing anxiety, or they might have had problems with anxiety in the past. And then they come to be having sex and they get anxious about having sex. So, for example, I presented on some Muslim women here who have problems with having sex for the first time, because a lot of them because in the UAE you're meant to be a virgin until sex outside of marriage is illegal. So because it's not like the UK and the US where people expect you to have had a sexual relationship before you're married and think you're odd if you don't. So because of that's normally normalised there, people aren't scared about having sex. But here, the breaking of the hymen and having penetration is such a big deal. Can you imagine it raises anxiety? And even things like being told as girls, you mustn't do this no matter what, and you're nothing, and you'll never get a man, and all these kind of things make it even more loaded. So it means that when it comes to do the act, it's a highly contentious act and highly anxious, anxiety-provoking act. And some women have held on to this belief, so I shouldn't be penetrated so much, by the time it comes to be penetrated by their husband, they're too scared, if that makes sense.
Yes.
So that's one way in which that's how things can lead to it being anxious.
Yes.
As I've said, if people have had a predisposition to anxiety, that can also heighten things. But thinking about men, I've worked with some men clearly who had anxiety before, but also some men who might have been under stress and something's gone on and therefore they've lost their erection, and that in itself has made them just worry about losing it again, and then they focus on their performance rather than being fully engaged in the act, more likely to lose it again, and that creates anxiety.
More anxiety. Exactly. So it's like a cycle.
Yeah, exactly.
Okay. We spoke about child marriages briefly, but I realized that different cultures view this differently.
Yeah, absolutely.
Right. And so I know that most cultures will call it child abuse, like the child were molested. Even if a culture doesn't acknowledge that the child has been treated in a less than desirable way, the emotional problems that the child will experience is almost a given. Or is it that if if a culture views it differently, or if a culture thinks that, okay, this is not necessarily abuse, it means that the child doesn't necessarily experience any problems in adulthood?
Okay. That's an interesting question. There's an excellent film that I recommend you try and see.
Okay.
I saw it at Dubai Film Festival, I think 2 years ago. It's an independent film. I think it's called My Name is Najum.
My name is Najum.
I'm 14 and I am divorced.
Okay.
And it's basically a true story about a young girl who at 12 or 13 was forced into marriage to a grown big adult man.
Okay.
And every time he tried to force himself on her, she fought against him. And everybody was annoyed. She was kind of basically sold to him for marriage, which was the norm.
Okay.
And she would scream and fight, and his mother would be saying, "What's wrong with you?"
What's the problem? Yes.
And everybody was deeming her to be bad because, despite the fact that she was a young girl, she was now married. And for her, this was not okay.
Of course.
And the guy couldn't understand it, and people didn't have much consideration for her feelings, bearing in mind she was a young girl.
Yes.
And she ran away, and luckily she went to the city, and she met a lawyer who had a daughter of the same age, and had education, and wouldn't deem to think that his child, some grown man, could penetrate her, so he saw that as abuse, and he helped for her to get divorced. But the process of getting divorced was really difficult because she's legally married. And so I guess, you're absolutely right. And I know in India, for example, they've been doing a lot of work in trying to reduce the number of child brides, so they called it, because there's a reason why in certain countries, I know the ages differ slightly in different countries, there's a reason why we put a legal limit around when people are supposed to have sex. Because when you're that young, you're not ready physically or emotionally. So it can definitely have an impact, a traumatic impact.
Yes.
I would probably say, for example, one of the basic things is when you're that age, when you're very young, you can't consent. You don't even know what you're consenting to.
Yeah.
And what we say is healthy sex is two consenting adults. And there's a massive power imbalance between a grown adult and a child. Yeah, which is why we call it a paedophile. You're old enough to know this child can't consent. Is it really what you'd want for your own child? This, is not okay. So it's not uncommon for people to have psychological problems, even if society says it's okay. Because you're married. If you're a young girl, one of the things I loved in this film, she'd want to play with her toys and all of these things, which really showed her age.
So
not wanting to engage on adult activities, she just wasn't ready to even be able to comprehend.
Of course.
Yeah.
Of course. That's brilliant. So we've mentioned this already, but just to summarize it, what's the most effective approach to sex education? Especially with regards to language, the kind of language. What's the best approach?
One of the things I'd say is giving sex education, because certain countries don't give sex education. And I would say do sex education at schools. I probably think it's better that somebody comes in who works in sex education, is really comfortable, that does this training in schools. There's lots of research that shows that actually countries where there isn't any sex education, then there are higher rates of psychosexual problems because people don't understand sex and understand what to expect, etc. So I think the first thing is just providing sex education, and children need to know and understand, and particularly so in the world now with the internet, where there's terrible things, there's lots of porn, there's lots of things that lead young men to grow up saying this is sex, this is healthy sex, when it's not real sex at all. Porn, it's people acting, and there's no intimacy and caring and sharing and all of those things. And in terms of language, as you said, it's kind of more or less what I covered earlier, really. Be honest with people and use the most straightforward language you can. And I think using biological terms such as vagina, penis, explaining what a clitoris is, explaining what an arousal is or orgasm, in a non-threatening way, a non-stigmatizing way, is really, really helpful to people. Obviously, you've kind of got to use age-appropriate language. But one of the things that used to happen in schools is people would talk just from a biological perspective about sex. I think you need to do that and use a sexual language, but then you also need to talk about the interpersonal aspects of sex. You both got to be respectful, you both got to be wanting this, and about the role of care and affection, intimacy, which are crucial to be anybody enjoying sex.
Okay. And Dr. Thompson, the question that brings our interview to a close is, how do you encourage help seeking among people living with psychosexual problems, especially those in a conservative culture? How do you encourage them to seek help? Because, we've said that it's not the easiest thing to do.
Yeah, that's a good question. I haven't. I've been very lucky in that in Dubai, I've been so impressed that the vast majority of my referrals come from clients who've told other people about, I saw Dr. Monica, she had helped me with this, that and the other. And as I say, locals, covered people from all nationalities share the information with friends or family if they hear somebody else is having a problem, which I think is impressive, because it kind of reveals I'm seeing Dr. Monica for something. So here, word of mouth has been incredibly helpful. And it does, and that's a good thing, because that's how negative things and myths and biases are shared by word of mouth. So it's really good that those positive things
are being shared as well.
But on that note, also, somebody actually approached me after my presentation, and they actually want to do some work on promoting psychosexual problems on the radio and in the media. So I'm going to be involved in that and try and do things at a wider level. And I'm really excited about that.
Yes, that's excellent. I'd love to hear. I'd love to tune in and listen to what you have to say.
Okay, thank you. Well, I've got your email. We'll keep in touch, and I'll let you know how that goes.
Thank you so much, Dr. Thompson, for your time. It's been an absolute pleasure talking to you this evening.
Thank you so much, Vanessa. Thank you for having me, and it's wonderful that you're doing exactly what we're talking about. It's trying to promote, mental health and psychosexual awareness, back in your country in Ghana. Good luck with it. I think it's a fantastic thing that you do.
Wow, this has been such an interesting interview. Time well spent. I've left with a lot of knowledge and also a bit of information about all of the movies and documentaries that I have to watch that I've actually secretly made a list of. You can make a list too. But on a serious note, this is just tip of the iceberg of the sex education that has to be done in schools, in churches, or in whatever different conventions or meetings that we have. It's important to use the right language, to understand sex in a cultural context, to use the right language when we explain it to ourselves, our kids, our peers, and gradually and eventually accept that there's no shame where sex is concerned. We call it as it is, we accept it as it is. And that's where the growth comes from. Thanks so much for sticking with us. As usual, I'd like to hear from you. Whatever your thoughts and comments are, let them come in. My name is Baba Dadzi, and you've been listening to Hearts and Minds Aloud. If you haven't already, subscribe, rate, and like this podcast. Until next week.